I had breast implants abroad in February, but now I have a hole appear underneath the one breast. The NHS has said I need to go private to have it sorted, but no clinic will help me. Yeah, this is a problem. And I unfortunately can kind of understand. I'll be honest with you, I can see it from both sides. I can see why people go abroad for surgery. Absolutely, I can. I think it's significantly cheaper than the UK, and it can seem attractive. And sometimes I wonder if the kind of, not the problem, but the issue is we are not explaining to people the kind of service we offer. I don't know what sort of service they offer abroad, so I can't say that we're doing a better service than they offer abroad. But what we should be saying is what sort of service we offer in order to let people make an informed decision. Because if we don't tell people what sort of service we offer, they're just going to go on price. Anyone would. It's completely natural. If you say, do you want this thing or that thing, and this thing is cheaper than that thing, and there's no tangible difference between the two, you're going to go with the cheap one. I would, you would, everybody would. So I do think that we need to do a kind of better job of explaining what sort of service we offer, because I see this. I do see this. I do see people who have gone abroad for surgery and can't get help, and it's very difficult because I always say to patients, look, when you pay for the surgery, you're not just paying for that 1 hour in the operating theatre if you're having a breast augmentation or whatever surgery you're having. You're paying for the whole package, and you've got to ask yourself, how can some people afford to be so much cheaper? There's got to be a question there. Is it really the same? Am I getting the same thing for so much cheaper, or is there something else going on? Because we do hear stories of people who struggle to get help post-operatively. And, speaking personally from my own practice, a huge part of my practice is seeing people post-operatively. I only spend a very small proportion of my week operating, but obviously, therefore, I need to earn a certain amount of money from those operations because I'm only operating a very small part of my week. The rest of the week is looking after people and seeing people in clinic. If I've got a different business model, and I know that some places like work more on a business model where let's get the surgeons working all day, every day, and not really seeing their post-ops, then you can earn the same amount of money because you're operating, 3, 4, 5 days a week, as opposed to me, who's operating, 1 day a month. So you can charge a lot less because you're doing a lot more operations. And so in a given week, you'd earn the same amount of money. But I wonder if then when one of those tens or hundreds of patients that you're operating on develops a problem, you may not have the time to deal with them. That doesn't help that patient with the problem. So, the message really needs to get out to patients pre-operatively so that they can make a decision on what they do, so they don't get a shock post-operatively, because we often see people who get a shock post-operatively who have a problem like this and then come into me or other people and say, look, I need help. And we'll be like, no, I've got my own patients to look after. I don't just offer an aftercare service. My price includes the whole lot. You can't just sort of buy the aftercare service. So it is extremely difficult for patients who have got a problem, having had surgery by a surgeon who's not looking after them, which is the implication here, that their surgeon isn't looking after them. I'm assuming that they can't go back to their original surgeon, because that's what is always the advice, is to go back to your original surgeon. Now, the NHS will help if you've got an overtly infected implant that's red and angry and you're ill. But if you've just got a sort of niggling problem, then often the NHS won't help. And this is a problem. You've got a hole underneath one breast after a breast augmentation. That is a serious problem, and you need help. But yeah, I don't think there's any answer to. Well, the answer to this is go back to your surgeon. That is the answer. Your surgeon has a duty of care to look after you. In this country, particularly if a BARPS or BAPRAS member, we've all got a code of conduct, and if we're not looking after our patients, we will be, you can go to the BARPS or the BAPRAS or whatever, and the GMC, and goodness knows who else you can go to, and there's certainly plenty of ports of call to complain if you're not being looked after. But I don't know what it's like in other countries, and it's a real problem, and I haven't got an answer for it except to say we need to educate people to ask questions pre-operatively. What if I have a problem post-operatively? Because I've spoken to people who've been told to go and see their GP if they have a post-op problem, which isn't great really, because the GP's got other things to do. They're not really specialists in this sort of thing, and quite frankly, if you've got a surgical problem, you don't really expect the GP to help you for a problem created by a surgeon. So